Coming up today, Priscilla Brittine watched cancer claim the lives of her loved ones, but she wasn't about to wait around so she could be next. How she took action before ever getting a diagnosis. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. If you knew you were at high risk of getting cancer, how far would you go to prevent it? Priscilla Brittine was faced with that reality. So the 37-year-old mother of three opted to have her stomach removed to try and stay alive so she could watch them grow up. But that was just the start of her preventative care. Here's Janine Keesley.
When Priscilla Brittine was just 14, her mother died of stomach cancer. Since then, she's lost cousins and other extended family members also to stomach cancer. But it wasn't until doctors referred the family to the University of Kansas Health System for genetic testing that Priscilla decided she wasn't going to wait for cancer to take her.
Hi, I'm Priscilla with Respiratory.
Priscilla Brittine is a respiratory therapist at the University of Kansas Health System.
Have you been coughing up anything?
No.
She loves her job, so when the time came to make some life-changing health decisions, she knew she was in the right hands. Although getting to this point was more than 20 years in the making.
It was summer. My mom had stomach pains, took her to the emergency room. My dad did. They dismissed her, said that it was acid reflux.
Less than 7 months later, Priscilla's mom passed away from stomach cancer. It was 2001 and just the beginning of Priscilla's heartache.
I just got the call, hey, your uncle's in the hospital. You might want to come see him. He has cancer, same kind as your mom. Come say your last goodbyes. He only is given 2 weeks. And before you knew it, he was gone. And he was only 36. My cousins, they're second generational cousins. So the mom got it first. She was gone in 2 weeks. The daughter got it, I think, like 6 months after the mom did.
That's when doctors knew something was happening with this family. They sent surviving family members to the University of Kansas Cancer Center, where doctors discovered they shared a genetic mutation called CDH1, putting them at risk of stomach and breast cancers. Priscilla was tested in 2018 and learned she too has the gene.
I felt like a time-ticking bomb.
But Priscilla's doctors at the cancer center said she had options that could save her life. A gastrectomy, completely removing her stomach, and the more than 80% chance she'd get gastric cancer.
I was like, how can you live like without a stomach? Like, is that even possible?
Once doctors explained the procedure, Priscilla decided to do the surgery. She has 3 boys, 11, 13, and 17. She wants to be around for them as long as she can, and she knew she was in good hands.
Very grateful, very thankful. I actually changed my kids' doctors, and just for that reason, brought them to KU. Because they will know their history, they know moms, and I'm like, this is very important. Like, this can save your life. Like, KU saved my life, like, seriously.
And we are so glad to welcome Priscilla Brittine to our program today. The story we just watched was devoted to your stomach removal surgery, and we're going to be talking about your double mastectomy as far as your next step in preventative care. But you were mentioning you were getting emotional watching that. Why?
Yes, it's been a journey. Looking back to where I was at and how far I've came has been a roller coaster of no other, but to know that I'm alive and able to be here for my kids means everything.
You were looking good in those pictures.
Thank
I
you.
said showing off your belly. I like that.
Thank you.
We're going to be talking about your double mastectomy, of course, which is why we're joined by Dr. Kelsey Larson, a breast surgical oncologist here at the University of Kansas Cancer Center. Good to have you along to talk about this part of this very long journey. But Priscilla, a lot of people were surprised to hear that you can survive quite well without a stomach. What has been the biggest change since that surgery?
Oh, wow. The biggest change is the eating, the trying to keep your weight on has been the biggest struggle of all, but I managed to get through it, and it's all I keep thinking is eating. What am I going to eat? It's constant of eating. So I eat every 2 hours to 3 hours. But as long as I keep on that, I'm good. I might have ups and downs, but it's something I can manage.
It's kind of worth it, huh?
It is. It's really worth that versus the other.
The alternative.
Yes.
So good thing you had your stomach removed, because doctors ended up finding a cancer in your stomach that no one had found yet. Did you need additional treatments to your stomach after that discovery?
No, I did not. The only thing I have been having is dilations. I've had frequent dilations just to have the stretch for my esophagus so that I can eat a little bit more. Other than that, that's pretty much about it.
And I heard you say it makes sense when you say a ticking time bomb, that's kind of what you really were feeling like watching your family members go through this. Did you feel kind of like this is coming for me?
Yes, definitely.
A scary time, and you have this genetic mutation, CDH1. It also increases your risk for breast cancer. Dr. Larson, just tell us what that mutation is. Break that down.
Sure. So when people have genetic mutations that we test for, it's something that's in basically all the cells in your body. It's something that sometimes happens when we're conceived. Sometimes we get it from mom and dad. So in your family's case, it's something that's passed down through your family. And the gene basically changes how our cells function, and so different genes make people at increased risk for different types of cancer. So many people are at increased risk for different types of cancer based on their particular gene. So the gene you have happens to be linked to stomach and breast cancer, but everyone's family history might be a little different what their gene could be linked to.
Which is why genetic counseling is so very important.
Absolutely.
We're going to talk a little bit more about that. But did you know that you were at high risk for breast cancer as well? When did you learn this?
I did not know until I met with the genetic counselor. She went over everything. She was so knowledgeable. I spent an hour probably or more with her. She touched base with everything, down to the family tree, how serious this is, what this means for my future.
And then you connect with Dr. Larson. What was that like?
Yes, that was awesome, amazing, but I had to wait a while to decide, am I gonna go with this, removing my breast? The stomach was a lot, but I was finally at a healthy time in my life where I thought, okay, I'm gonna do this, because there were several cousins that already had the breast cancer. So it was, honestly, I was getting scared, thinking, oh gosh, I still want breasts. But I was going in, getting checked periodically, every 6 months, alternating MRIs and mammograms. And I've had to do that for the rest of my life.
Were you kind of getting tired of doing that?
Yes.
You thought, if I do make this big step, then that takes that part out of the equation.
Yes.
What were those conversations like with your family, with your spouse?
My husband, he was like, are you sure? I'm like, I'm positive. I don't want to have to do this. I mean, we're talking the rest of my life. I mean, all these scans, I mean, the radiation, I don't know. I just thought more scans. I mean, how much these scans cost also. I mean, I think removing my breast was the best decision that I made.
And your age really played a part of that, I would imagine. Young enough, you got a lot more life to live. You got 3 boys you got to take care of. Dr. Larson, what was it like when you first met Priscilla? Did you look at her case as somewhat of a challenge? Is this something you typically see, somebody coming in for this preventative procedure?
Sure. So many patients, when they're coming in seeing us or talking to us about this type of a mastectomy, already have received their genetic testing results and have some information from the genetic counselors. We also have a really excellent team here at KU that's called the Breast Cancer Prevention Team. And so most of our patients start out with the breast cancer prevention team. They learn a lot more about their risk of breast cancer. The prevention team helps them to do things like stay on top of their imaging, talk about any lifestyle changes or perhaps medications you can take that help to lower your risk of breast cancer. And then ultimately people kind of decide when they feel they're ready to start exploring surgery. And most people, most of the time when they come and see us, they'll meet with us several times on the surgery side to learn more about it, to learn more about the pros and cons, and really find a time in their life that might be right for them, or identify if that's something they want, or if they want to go through with that increased screening and proceed down that route.
So you're also helping counsel them. So Priscilla kind of makes the decision, I want to do this.
Absolutely.
But there are times people come to you and say, I don't know if I want to do this. You have to help walk me through it.
I would actually say the vast majority of the time when people come and meet with me the first time, we call it a fact-finding mission. So they might have read things online or heard things from friends and family, but they really want to know the facts for their particular situation. And they want to know some details and ask some questions about what their care would look like, or how they might be treated, the good and bad for them as a particular person. So it's really common for us to start with that fact-finding mission and that conversation, and then meet several times to get to the point where someone decides yes or no, this might be right for me.
And do you think this proactive approach is going to become more common as people start to take their health and their future in their own hands and learn more about genetic testing?
Yeah, absolutely. One of the misconceptions that's present, I would say, in the world, and some of the feedback we receive, is people are surprised that genetic testing is available. It is something that insurance often covers based on your family history, or if not covered, it's actually quite affordable. And so for patients who have a family history like yours, even a couple family members who want to be proactive, who want to kind of take a proactive stance with their health, it's really a nice opportunity. And the fact that it's more available within our community, within modern technology, is really, really excellent.
So in a case like Priscilla's, let's say somebody comes to you, sits down, you talk with them, and they go, you know, I don't want to do it. I don't want to have the mastectomy. What other options are there to help decrease their risk?
Right. First of all, we encourage everyone to come and talk to us, even if they're not sure they want to do it. My job is not to try to advocate for you having surgery, but to give you the facts and the information to make that informed choice. But I mentioned our breast cancer prevention team, and so from the breast cancer standpoint, we have a high-risk breast cancer prevention team that helps people who are not quite ready for surgery, or maybe are not interested in surgery, be followed a little bit closer. That could be more frequent imaging, more frequent exams, perhaps medication or lifestyle changes to lower their risk of breast cancer. But it's not just for breast cancer. We have that in all areas of cancer care. So there are people who monitor that from a GI standpoint for pancreas cancer, gastric cancer, colon cancer, all sorts of things. So even if your family history or your gene may not include breast cancer, there are proactive and preventative teams here at KU who can help you to stay on top of your health.
Priscilla, how powerful did this make you feel?
I feel like I was able to take things in my own hands and determine my own fate, because my mom, my uncle, other family members didn't get that chance. They unfortunately died at a very young age, but if I have the knowledge and the power to change that, why not?
How was your recovery?
Oh, my recovery from the mastectomy?
And
it was
compare it
rough.
to the one with the stomach surgery. Two different areas of the body, but explain the difference.
The mastectomy surgery was rough. I think more so with the pain, but I was able to manage that. What it was, the pain meds were just making me sick. I think that's maybe because I'm so sensitive without having my stomach. So I kind of weaned myself off a little sooner than normal, and just did Tylenol and tolerated, just kind of was being that strong person. I got this, it'll be fine. And other than that, I think that was not as bad as the stomach, though. The stomach was far more worse.
Longer recovery.
Yes.
Far worse. What about reconstruction? Where are we with that?
Well, I had that December 1st. It was supposed to be scheduled out months, but they called me back and said, hey, your cancer, they sent my results out to lab, and I was cancer-free for my breast. So Dr. Larson said, you're good to go. And Dr. Lay, he called me and said, we can schedule this sooner. So I went in December 1st for my reconstruction. Like, it was like back to back, it felt. But I was like, are you sure I'm gonna be okay, be healed? They said, yes, it's totally fine, you're fine. So I went in, and that was another 4 weeks. And that was actually not bad.
What's the reconstruction conversation like when you sit down with your surgeon? What kind of questions are you asking?
What I'm gonna, basically, am I going to have any complications later? And I I had a little bit of rippling, but that's because I was already thin, and rippling just means like the skin is a little bit thinner than a normal person. I was already lean to begin with, but that was okay. I wanted something versus nothing, just being a woman, and that's what I opted for.
That's okay to say that. I'm sure that's a question. A lot of women, they come in, they beat cancer, and they're wanting to put their health first, but then reconstruction is about the aesthetics, and you want them to feel comfortable just claiming that back.
Yeah, absolutely. So when we do mastectomies that include reconstruction or do not include reconstruction, the relative cancer risk reduction is exactly the same. And insurance does cover any sort of reconstructive procedures that would happen alongside of a cancer operation or cancer prevention. And so it's really about what someone is interested in or wants in the end, as far as their aesthetics and how they feel proud about themselves after surgery. And so there are a lot of different options that women have, and it varies according to your body type, according to your other health situations. So you had mentioned at the beginning, because of your stomach surgery, nutrition is something you really have to focus on. People who have had that operation need to be mindful of nutrition. Nutrition helps us heal. So whenever we're doing other surgeries done in follow-up, we as surgeons need to make sure that we are remembering that and talking to you about that. But other patients may have different factors that factor into that, whether it's heart disease, diabetes, those sorts of things. So that's really the idea when you have a surgical specialty and a surgical team, is to look at someone as an individual and to say, what are the unique things going on with her in her particular case, and how can I do my best to ensure a successful outcome for what she wants.
Yeah, and another specialty, of course, we have is genetic counseling here at the health system, and Dr. Stites next week is going to dive much deeper into this conversation. But I want to talk about it as it pertains to your case, Priscilla. What were you learning along the way? I mean, as Dr. Larson has said, some people don't realize that genetic counseling is something you can pick up the phone and call and come in and get that done and take that power back. But what were you asking? What did you learn? What stood out to you?
What stood out to me was, it opened up my eyes to, so many family members are not here because of this gene, and it's just because of this gene. And it opened up my eyes to, my life could have been taken away. I wouldn't have been here. I feel like I really wouldn't have been here if it wasn't for genetics and for me just picking up that phone, making an appointment, and then went in, an hour visit. They took my blood work another month, waited for my results to come in. Then they return you back to genetic counselor to go over your results. And then they break it down to you, what this means. And it opened up a door to my whole team of doctors that just came together and helped me get through this.
Are other family members following your lead?
A few of them are, yes.
They have a lot to learn. I think you're educating. I think the last time you were on, you were talking about how this is generationally, people maybe don't want to know. Do you find that, Dr. Larson? Some people just don't want to know until they have to know.
That's a big step to get results back, right? And it's a big step just to take the first initiative and pick up the phone and go to the appointment. And what happens when people pick up the phone and ask to meet with a genetic counselor is that, as you've experienced, a genetic counselor will learn about your family history. They'll give you some recommendations about what you should be tested for, or you can be tested for. And then at that point, it's people's decision whether they want to proceed with that testing or not. So at every point, there's kind of a decision tree. Sometimes people aren't ready for that information. I'm sure I can imagine that it was overwhelming to learn about that and to try to figure out next steps. And so when someone is ready for that information, ready to be proactive, it's wonderful, it's there. And if someone is not quite ready for that, again, along the way, we can provide education and help in that decision-making process so that you can decide what's right for you and your family members can make the same decision.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Information is right there on your screen. A quick note to our loyal viewers here on the Morning Medical Update. Dr. Dana Hawkinson will now appear just on Monday, Wednesdays, and Fridays. He will not be here on Tuesdays, but he will be here 3 days a week. But today, I wanted to give you this update. This week's COVID count is 15 inpatients with 2 in the ICU as of Monday. Well, you are, Priscilla, as we know, an incredible advocate now. Recently, you met with Governor Laura Kelly. What were you able to accomplish?
Well, I met with Sharice Davids.
Met with Sharice Davids?
Yes, Sharice Davids.
Go back to that, because you met with her in D.C.
So I'm part of a Debbie's Dream Foundation advocating for stomach cancer. We went to Washington, D.C., and we were able to physically meet with Sharice Davids. And that experience was awesome. She heard our individual stories, and she listened is all that mattered to us, but she genuinely listened and realizes research really plays a part in all of this for us to get funds for all these cancers, but especially we were there for stomach cancer. So we just went a couple weeks ago.
And then tell us about the proclamation.
Yes, I got a proclamation this past year for having November being Stomach Cancer Awareness Month in the state of Kansas, which Governor Kelly approved that. Thank you. And Kansas City, Missouri, I had got another proclamation for that, and we got invited to Kansas City, Missouri for the municipal from Chris Manraya.
And we have some other photos here, just kind of talking about your advocacy. How rewarding is it for you to, you never want to be the face of cancer. You never want to be standing there, but gosh, we're kind of glad you are.
To be honest, I thought the same thing, but I'd rather be an inspiration and be a voice for those who don't have a voice, and to be there for other people and be able to help and spread awareness as much as possible, because these are lives we're talking about. If I can prevent another family from having to go through this or losing their loved ones, means everything.
You're doing great work. You're going to hit the runway too soon. Tell us about that.
Yes, so I am one of the models for the bra contour. It's April 19th. All the funds are going to the uninsured it used to be just breast cancer, but they changed that about 2-3 years ago. And it's all cancers, and it also helps for any type of nutrition, any prosthetics, anything the cancer patient needs. It helps, and all those funds go back to them.
And people who don't know about bra couture, tell them what it is, because you went to a fitting last week.
Yes.
You're actually in a bra, all done up, walking down the roadway.
So I have my own designer, my hairstylist, everything like that. I feel like, I guess, a celebrity, but they're making what I feel like is really awesome about this is they're making my bra for me, and they're bedazzling it. I can't wait for everybody to see it, but they made it by hand, and I will be wearing it.
They're pieces of their artwork, aren't they?
Yeah.
Yes.
They're beautiful. What it is it's basically a runway show, and the patients come from all over the city, as you said, different types of cancer, backgrounds of cancer. And the idea is we want people to share their story and what brought them to that point. And then it's actually a ton of fun because people, our patients, walk the runway and we get to cheer them on. There's all kinds of things happening, food, live auctions, a lot of ways to raise awareness, but also raise money, like you said, for people who are underinsured or uninsured to get those cancer services that they need.
Great stuff, and I want pictures when you come back in November. Sound good?
Okay.
All right, let's get to some questions from our viewers this morning. Dr. Larson, question is, how does this affect Priscilla's children in the future? We've talked about some of her pre-generational family members and educating them, but what about her kids?
Sure. So different genes are passed down in different ways. And so the chance of an individual passing down a particular cancer gene to their children is different depending on what type of gene that person has. So the genetic counselor is part of the conversation. They'll talk to you about what is the likelihood you may pass it along to your children, and then also help figure out timing if those people want to get tested for those genes. Most often, people are not tested as children. It is testing when they are able to make that informed decision for themselves and take ownership of some of those healthcare things. But it is important for parents to know and to be able to speak to their children about that and help kind of guide them through that process. So that's all part of the genetic counseling conversation.
So on that note, Jeremy is asking, is genetic testing typically covered by insurance, or is it only if you have a family history? What if you just want to know?
Yeah, so if you just want to know, typically that is not covered by insurance. Genetic counselors will still visit with people, and so if someone might be adopted or they just want to know or they're not familiar with their family history, you can still absolutely request a meeting with the genetic counselors, and they'll be able to advise about what cost that testing would be. In the olden days, the testing used to be tens of thousands of dollars. Now anymore, the testing is much more affordable. I hear recently it's under $500. Don't quote me on that. I'm not a genetic counselor, but they'll be able to tell you the exact amount. So it's becoming something that is more tangible for people, even if insurance does not cover it.
A couple questions about your stomach removal surgery, and you touched on it regarding your pain meds when you had your double mastectomy, but just question if you digest medicine differently now with no stomach.
Yes, I do. A lot of times I have to have the liquid form of most things, or chewables, not the pills normally. It doesn't digest without your stomach. You don't have those enzymes to help absorb for the absorption part.
So Jean wants to know, you mentioned that you eat every 2 hours. He's asking, does that interfere with your sleep? Do you do that? Does it wake you up in the middle of the night? Can you make it through the night?
I get through the night. I don't wake up at nighttime. I sleep, but it's more so during the day, because if I go, which I have gone to longer without eating, I feel it. I will feel nauseous. I'll feel dizzy. And I'm like, oh gosh, I gotta eat. So it's kind of like a diabetic.
You don't have the hunger pangs, like you mentioned that. So you have to just almost go by the way you're feeling in your head versus where we often feel it in our tummy.
I've had to put an alarm set because sometimes I don't get those hunger pains. So I have had to put an alarm on my phone to remind me, hey, eat something.
What about mental health through all this? Have you met with a therapist, a psychologist to help manage some of those emotions?
Yes, I have. You have to. It is overwhelming for all that's coming at you with all this information, and you're like, "Whoa, this is happening to me. I'm going through all this." I mean, you're going through a roller coaster. That's as close as I can explain it. Is just a roller coaster of emotions, because your family in the background, they're watching you go through this, and then you're seeing their faces, and then you're dealing with your own pain or your emotions, and it's just hard to deal with. And then the stomach, or the weight was up and down, that I felt like it took a lot for me, as in I felt like my body, physically, and I had to see a therapist for that. And I mean, I am who I am, and I've came to accept that with my body, and I mean, this is me, so.
This is you. Dr. Larson, what's the biggest takeaway from our conversation today?
Yeah, I think the biggest thing that I think about is I'm so proud of you about what you have done with this and what you are accomplishing, and we are so appreciative that you're here to speak up as a patient advocate. If someone is not quite ready to have the genetic testing but wants to learn more, come and see us. If someone is not quite ready for surgery but wants to learn more, come and see us. If someone just wants to learn more about what they can do for their risk of cancer, just come in, just call and come in. We have people who want to give you information and to talk to you no matter where you're at in that decision-making process, and to support you through that.
And we talked about this before the program. After the program, we're going to put the number that people can call
Absolutely.
In the chat thread below. Priscilla, thank you again for coming back.
Thank you.
You'll be back again. We love having you on. What's the biggest takeaway from your story?
The biggest takeaway is know your family history. And I know that people probably hear that over and over and over, but it's so important to know your family history, because, I mean, genetics, we've come into a world now where you can go, it's easier now than it was back then to get genetic testing. Like we said, it's just a phone call and you schedule. It's a matter of you getting there is the hardest part. But once you get there, then it opens up doors that you're like, wow, you know, especially if you have family members who you know had died at an early age or have had certain cancers, and you're like, oh, you have a family of your own and yourself. I mean, like I said, knowledge is power. If you have it, be proactive. Take action, do something about it.
Well said. Thank you so much, ladies. Thank you both for being here with us
Thank
today.
you.
Thanks to all of our viewers for being with us as well. We'll see you back here tomorrow at 8. When prostate cancer spreads, a new kind of treatment can seek it out and destroy it. I'm Jessica Lovell on the next Open Mics with Dr. Stites, the radioactive particle that doctors compare to a heat-seeking missile, providing a better life with fewer side effects. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.